ebusiafo me ne Dr. Stephanie Pettingill. And you know the me who border, but yenua Ghana ni our Connecticut, and will be family clinic our Connecticut has say intino, and then on necessary me bana me besra no na me de hanom echre ema yenua no ma ye Ghana for say ye hwehwe baby a yebehwe ya pomudin a na che say ye twa ye ni aba ye sister honom oti yonkrom kasa oba obetumi a cheche ne momu bebreda a chero say wo insurance wo ni insurance de wo mu bia wo ba ha omo no beka kama enti wo hwe me a bombodia say wo be share video no e de amame because ye hia bibisa and then at the same time so me pese me da na sekese because muhu say ye so many donation ewo NDA platform so and de bia or supporto enti no ya ba na ye ba beda na se na baby preko aye onye sika ne fi no so ye de akyeremo se de be ya obekoso aboa nkrofo bebreda umuhia mboa ewo yan mangana ene aha at the same time so uhia apomudin so a na wetwa weni aba hanom enti medro official pa
I think converted ye
and I do know the pink
Pettingill.
Pettingill. I am Blvd na.
I
know I'm fine. Doctor, how many years and why a doctor?
Well,
Thank you.
I know so a very huge platform, and I want to use a platform ye dankophobia sick. Akran sana ma wakasa. It's Auntie Rebecca, Cornelia Harriet, Frida, Eniemba, Kweku, Eric Ne Abeku, Midamunyase. All right, and I need Papa could be any who hear me PR. Near because I may your friend is the public relations officer. I Peter Usu and then Frida, Dr. Frida Usu, with all my say. Now, Baba Pettingill, Stephanie Pettingill, me a friend me a nurse practitioner, family nurse practitioner, and me started many years ago.
Okay,
this is about 25 years now.
Wow.
Yes. And I started with an associate's degree, very on the bottom low, right? And got an associate's degree, went back to school and got a bachelor's degree. And then I went back again, got a master's degree, and went back and then got a doctorate in nursing practice, so doctor of nurse practice, right? Into 25 years, that's where it's taking me.
And you who say, Mr. Gina has saying, say, you're more so, Pacho would deem.
Pacho, your friend, and you probably bring me as Kaiko, but I say James. Yes, we both deem your friend James Amponsa. James, Dr. Stephanie, Baba Pettingill.
and yet that was to say, like, when you said, dear Kosobenia. Would you more cotton and into Yankopon sharp? Yankopon sharp, I say, or ye mana was supporting because then yet that easy, sir, but Yamin shall no one more than the support. So, maybe says a Ghana for Baha.
Aye, Ghana for patients. Almost about 100 Ghanaian patients were having. And also, anything I made that me PRO, I say, Peter Usu, Wabwami Bibre. Or wanting for mommy or sharing for coin and yeah.
But Usham Kola, Usham Pinfo, wine, I will show
me a family nurse practitioner said I make to meet me and Colani penning for. However, they started from the age of 18. My preference is that me from the age of 18 up until 100.
Okay, so Usham Kola, Ubet show but who prefers or from 18 years. Okay, so yenya 18, 100. And now 200 about the share. And Yarubang and I say, or how Ben you bet me dinner abanum, or you'll be a shitty Yaron because me was a doctor for no. Now, say when me call baby, I always me show that I call wrong places, I made a call different place. And thank you, she's been taking care of me for my shoulder for some time now. So God bless you. God bless you. My friend and Andre and Napa. So thank you so much. So then yare ben I will share. Who will be I won't share and I said then.
See, I have primary care. Primary care, you focus here preventative medicine. You say preventing your man sana be yare kramai.
Okay.
Right? Into your physicals, right? Or by your show mujemu ye lab work. Now the muja be can you know discuss it, right? To high blood pressure or cholesterol or diabetes or thyroid. When you're COVID, when you're flu, you know, this is primary care. That is what we deal with. It's surgery, right? We have pre-op clearance, or by a day pre-op clearance is normal. We have referral to say the Okano. We have referral over your shed your referral to the right place. So it's no you should be there. It's no banner say here, say a baby with specialist. Near refer specialist. Now specialist and so I communicate with whoever I'm sending you to. It's on show we cry and no matter why day.
Okay, so being an accident, no baby who but you have who and some physical therapy na dia and I said
and also come home. So when accidents now we're primary care. We primary care provider. Now I referrals so physical therapy. And now x-rays, MRIs, CAT scan, whatever is needed. Insurance is not required. So we primary care provider will be doing you.
Okay. So would your insurance be an won't insurance?
Major insurance, major husky. A lot of providers now have normal pay state insurance, but maybe they major state insurance.
Okay.
And it's major Medicare, Medicaid, Cigna, United Health, Anthem, Blue Cross Blue Shields, any other insurances. And we insurance in Swalba with a very subsidized amount. You know, very, very, very. It's a peanut, just so that you can have access to the care. It's not about the money, but it's actually about you having access into an insurance. Oba Michelle, you didn't walk across Michelle for free. We charge you almost, you know. And
yeah, go for show and Sisi, I miss sure who show me I know what share me video na Eddie mommy na yene doctor make us say Pickens Pettingle okay Stephanie be the Dr. Stephanie I know need me to me the friend no and what in America for how many years me
our has since 1995.
1995. Oh my God. So since said me about weight loss and who says she see no there were so many medication and drugs I bet me I lose weight. And do you do weight loss you have treatment?
I do. Okay. I do weight loss treatment.
Okay.
And to what we interested
okay.
And we use semaglutide. The generic version of Ozempic.
Okay.
Right? So semaglutide are coming from compounding pharmacy. Okay. And we also do it through insurance. So insurance is because some insurances allow for weight loss management. Okay. Right? And they will approve semaglutide, which is Ozempic, and as a Manjaro, tirzepatide, they would approve it. It is saying we insurance approve, we use it, we do it through your insurance, right? Okay. And if your insurance doesn't approve and you still are interested, we can go the compounding pharmacy route.
Okay. So why what started weight loss? What started like wait do and pemper so in abeji say bia okay nipa we ohia sa treatment and e bia say me wa hanom say right now me weigh 195 and me change me 5'6". So like ube kase bia right now me my bro me weight so me here sa injection and me here sa drugs no and I say one bro be 200-300 pounds say kono.
So that's a very good question. However, answer me a bit complex. Now, the BMI and right? Maybe height, no weight, no, it may fit you, right? Or be to say me, I'm a very short woman. so weight in the woman, it wouldn't fit, right? So we use the BMI to calculate, right? And obesity is a big deal in America. Almost like we'd say over 50% of the population is obese, right? Over, exactly. And obesity, if you look at it, it causes a lot of problems, right? It's the underlying problem for many illnesses and conditions, right? Even some cancers, it's obesity driving on. So it's very important. It's highly important. Say every you weight, right? Through weight management, we are managing our blood pressures, right? We are also taking care of diabetes. We are also bringing out our cholesterols down. So weight loss at all avenues, it's important. So therein comes these medications, right? Ozempic, these medications came out for diabetics, right? However, they realized that it was really helping people lose weight. So then it was branded also to be used to help with weight loss management. So it's not necessary so you lose weight and you have to be on these medications, because it has to start with lifestyle modification. What I say, wash away exercise. So what I say now, exercise and diet together should be able to help you. However, we've realized that it doesn't help everybody. Not everybody does the weight loss. Diet modification and exercise and all the sort of thing. But you shouldn't be solely reliant upon it. So because that's you have to change your lifestyle. Okay. Now, we've noticed that these medications are also prolonging lives, right? Ozempic, it's considered liquid gold. It's helping with cardiovascular problems, right? Microphobia, strokes, and diabetes management, and it's really making a turnaround in treatment of diabetes, bringing success, good outcomes. So we are diabetic, highly recommended. So no, Dr. Bekasa, it's not only about weight loss, but also trying to really control that disease process. So
all right, so a few days ago, a lady or a musician, and she was talking about this. She took the medication Ozempic, and she was on it for 1 year, but one was when you bone loss. And Tina, me person maybe say no cray, and I said then, and I side effect is said ye beya yenu no ma omo hwe say bi obi wo person okoso and obi wo person oba won chen na dia this a food to be a betim dia mayen yen betimi e dia to ye ho be hwe yen. So
Ozempic, one of the things it does, and it does it very well, is weight loss, right? Some people lose their weight very rapidly, right? And with the rapid weight loss, you run the risk of bone loss.
Just say obi lose no shim.
Yeah, it increases the risk of you losing bone mass, right? So lose bone mass, it places you at high risk of getting fractures.
Okay. So
she could be right. The rapid weight loss, leading to drastic bone mass decline, right? Increases your risk of fractures and so she probably has experienced that. But you should also understand that these medications are very new, right? And we are learning, we are still understanding it. So from all the collection of all these data, and so she's probably right. She's probably lost that bone mass and probably can be attributed to a drunano.
So what advice Bernard be my obia ye pese ye koso ni ade mam ye koso mam ye num ni bebre ana ye nti dose no so kakra na se ye be ye ndan ya ye ntumi enko lusu our bone loss said they are all kano
obia will reason why or dead drone so remember, it's not only for weight loss, right? It's also being used to treat other disease processes, other conditions, especially diabetic. Diabetic, in fact, the people that are diabetics, they don't lose that much weight. So when you are or prescribe a drone patient. No, they should be the one controlling what happens. So yes, and the patient should also be advocating for themselves. Thereby, they feel say me so tedodo. What I say, and I may feel say, me bones cry me. You should be speaking up. So it's also one car who provide and winning the year. So it's say, until I was say one person to me a kuma wow, kasama wow.
Okay. All right. So right now, we figure na buy and play, and me who so many things also Ghana, like you hear so much help, and America hanum saying, Ghana for our more sharing ubia onya sika kwa beko hospital ni adie. Edin ade na obetumi aka kyerɛ for apomudin. So be sharing pona be on call doctor for some time and na bibisa. Edin ye futu na de bema yen. Ebetumi aboa ye ma ye be ye ho yen yare intentem and ebebo ye ho ba ye fi yare bebre da ho.
Very good question. And with our so we only have one body, one life to live, right? Or body, a reflection of the awodiano. What's it now? No, so better at the right time.
Right? I hope I'm mutene kasa no nti me pa mo cha mo share me video na mo ma yentene kasa no some more. Okay.
So or body no. The way I'll be treated body no. And then also be treated in the end. Which any year into pennies or no, or no special year. Yeah, well, in marijuana and cochraphobia, they're doing very well. Energetic, exercising, going about their business, not on any medication. And then they were almost the direct opposite. They're on every kind of medication. And then you go back and ask, what could have been the difference, right? If it's not a genetic problem, how I your lifestyle. And they catch me patients, they say, why you exercise? No one did you will end up on medication. So what drew anyhow I'll be shown. Understand me? So take care of yourself well. Well, every day now we'll call gym 3 times a day. And you drew out.
3 times a week,
3 times a week, sorry.
Okay.
3 times a week, I correct myself. So 3 times a week I will call gym. 150 hours a week. 150 hours a week. I will call gym. No excessive alcohol intake. There's a problem, right? You're eating meat, don't do it excessively. You're drinking alcohol, don't do it excessively. Increase your physical activity. Eat well.
Carbs.
Eat well, take care of yourself. Sleep. Good sleep hygiene. All of that is important. To me, those things are medicines right now. What I said, you don't end up having to take an actual pill. So once a year, I always tell my patients, and I have my staff call them, tell them to come in and see me. Once a year, come get a physical. Let's look in your blood. Let's see what is happening. Let's make sure that your A1C is not up. Your diabetes is not getting out of control. Cholesterol is not getting out of control. How would you know? You wouldn't know until you do blood work. How would you get blood work? You have to go see your provider. How would you see your provider? You have to have a PCP. So all I'm saying is find someone that you like, someone that you can trust, someone that you think listens to you, and connect with that provider. January, me physical, then you come back again in a year. Mammograms, once a year, now swap your mammogram, maybe, when 45 and older. Colonoscopy nibi. Una also colonoscopy.
I don't know the other show Sebi when you ma would turn on.
Yeah.
And for them.
And no, the show colon, right? Into the camera, a share or rectal area goes into your colon, and then they look to see if there's any abnormality, any cancer, right? They look to see if there are any polyps, right? If there are polyps, no matter biopsy, I say cancerous and precancerous, and I say, there was a sign because it's a sign fifi. But colon cancer is something that is slow growing, So I say, ain't you know, would be 45 and I saw who moja crowd stool more. Kona kwa kacho PCP, the encontral. Because you're sharing tema, it's me, it's a non term. And until I make us a slow growing. So I say, that's why I'm going to obey them. It's very sad, say, young person now we're from colon cancer, which is preventable.
Betumi abɔ ho ban.
Betumi abɔ ho ban. I know some people be brain stroke, some be colonoscopy near some also won't pay colonoscopy cry. You another route I'll betumi akɔ, which is the Cologuard box bina ye de be bro fee will provide a casa. They go and check for cancer blood in the stool. If there is blood in the stool, then you really need to have a colonoscopy, right? But if there's no blood in your stool, you can repeat that test in 3 years. So there's no reason not to get yourself checked out.
Okay, and na enufu swe,
Yenufu the mammogram. Or baby, once you hit the age of 40, you should have a mammogram. And our family history of breast cancer, you have to tell your OBGYN, and that's our primary care provider, so that you guys will come up with a decision whether to check you even before the age of 40. Right? Okay. And if you feel any tenderness, any discharge from your breast, and Tamara, Kwanakoka, mammogram, maybe. Like East Hartford, they have a free bus that goes around. I have the number I give to my patients. It's free. So there's no reason for you not to get it done. So I say.
Okay. Na mbema so womo wo te se mba waka say yenufu no. Se mbema de yenya ye
colonoscopy.
Ye mbenu ni mba ni mbema ni ye bi.
Yes.
But mbema so womo sunya from 40 years I say wo so ye bibi anase.
I was so check your PSA. Prostate. Almost prostate. Okay. Now, no, me so sister discussing PSA. She does very well. Actually, when you're down for yeah.
Shout out to Mercy.
I know your PSA. It's where the 40 family history of prostate cancer. You need to let your provider know. Right? Now, we'll check your PSA in term, and through the PSA, they can tell if there's a problem, if you need to be looked at more closely or not. Every year, when you have your physical, your provider will check that PSA level as well.
Okay, so me pamucho bombodia na we share video ni mayen ye suade at the same time so or boyen papa into your say wapomudin any you withdrew ana wapomudin you withdrew ntino and one say obehwe on ye said e be ya ruby embe ball obedidi ye obeye exercise ono mensa manum ni bebre and ndro ni ade so wonim say Ghana ye keke ndro bomu pa because me call Ghana make say me shoulder no like a drubi or what where you pain so when because of we say one more my prescription they said I have me obema me prescription na makwa jinti obetimi akota wo pharmacy na wanum na feel too much of it so ebetimi ahaye wo kwambi so. Yes,
and it's a very big problem in Drono. You have to know and you won't know, but your renal function. So chronic kidney disease, kidney problems will hope up. A lot of people are hypertensives, right? And a lot of people are diabetics. The two things together causes kidney disease, right? And some people have kidney disease from other issues. But people don't know they have kidney disease. Most of these medications, they are renally calculated. You have to know renal function. And how do you even know that this is the right medication for you? You don't know. And your man you don't even know what it is that you take it. So you're really putting yourself at risk. So but most importantly, like people will be popping Motrin just like that. Maybe go to the Motrin. But too much of that can put you in heart failure, and it can also cause kidney problems for you. So I've had patients go into heart failure because of excessive use of anti-inflammatories. Non-steroidal anti-inflammatories, which is Motrin. Right? So you got to be very, very careful. Pharmacy just because madam for be nutina means to make because we need area and I'm poor down for the crown so I say no have a problem amount. You know, so I highly don't recommend say yeah you kwakujina pharmacy na ya to ya yedru just because. But I can also understand and appreciate say the system of Ghana is a bit different than Hano. So what I say.
Ebusiafo okay enti mo share video no emfama yen at the same time no so no o Connecticut hanom say na o pe baby abehwe wa pomudin a bombodin na bra bombodin na frey ye the address no any phone number ebetudwa and oyo ukrom ni Ghana ni a wo ba ha obehwe and you ono brofo kwa na oka so even if you are not a Ghanaian, and I know most of my viewers they get mad at me say why I'm always speaking Chi, then they don't even understand. So we will do a little bit of English when we finish. I don't know how I will do it, but we will. So if uhia obi a baby abesho apomudin bombodia na freno na brahanum na besho apomudin o freno na oba wo mu no bedi nkombo o won krata omo besho wo ni krata so besho at the same time o insurance on besho uni insurance so besho sisi America yeyem hihyin o nkrata sam na ye serious yeah
but me had a sankrata sir me had a purely healthcare. Okay, I don't need to know anything about that. Okay, right? All I'm interested in is your well-being. Okay, so Drew Hanoma and question be akra maybe some. Into ba me pacho my yemo shisho.
Ma yemo shisho.
Me here our ID so cry for me.
Oh, we need ID.
But I mean depending.
Okay. And then location, pacho location no. Yen location here
477 Connecticut Boulevard, East Hartford.
So
Suite 119, 477 Connecticut Boulevard.
Okay, so we are the address in there, but 477 Connecticut Boulevard. Inti me pacho bombo diana share video ne my we are be post video BM with ne address and any BBA. Try your best to share, and at the same time let's come and see them. Is some cabia person will be son on near dear or phone number
860-216-9976.
Pacho repeat the beer
860-216-9976.
Okay, yeah, the better video no so said the bay I'll be to me a friend no now be to me a banner by show up pomidin. Yeah, you know, Pacho be to me the Ahanon Kakam. Did say in some way say maybe say near your visa. I don't know so will be a bit to me or person catch them crop for almost show you any idea.
Well, Madam Winas is somewhat saying, you're all welcome here. One of the things I emphasize on in my clinic is respect. You know, we respect everybody. Human dignity is really appreciated and emphasized on Intimate Pacho. I had a bumupa, you know, feel free, come in and let us know how best we can help you, and we are willing to. Right, so we're willing to be a listening ear for you. We will listen to you. You say, "Asumpara," you can say, "I don't know," but.
Kina, I think.
I didn't fancy in the eye, bro. Or the eye medicine. Or the fancy in the eye medicine.
You are welcome. You are more than welcome here. Come here. It's your home. It's your clinic. One of the things I love is when my patients will call me. In fact, most of my patients think I'm their friend. You know?
Which is very good.
It's interesting. You know, they will call me and tell me, "I just want you to know I got a new job today." But I like the fact that they do feel that way. You know, they feel welcome. This is a home. It's we try to make it very friendly, you know, so that you feel at home when you're here. Right, and your information is confidential, because I know that's one of the things Ghanaians are very concerned about. Now, hey, me ko Ghanaian or the master you know, Antissa. This is healthcare. This is healthcare. It's healthcare. We respect you. Your information is confidential. It is not going to be out there. All right, so please do not be overly concerned with that. Right.
So what was our friend? You bet me I take it. Yes, or say Helena say yes, too much of painkiller can kill. We must avoid it. But then when you are in pain, so what can you do? Because when you are in pain, you need the pain medication. So
But it depends on what the pain is, right? Where the pain is coming from. And there's Tylenol. Tylenol is good if you don't have any liver problems, right? Tylenol could be a good option for you. Yeah, well, icy hot tea, Voltaren gel. There are all these over-the-counter stuff that can be used, right? Thoraworks, all these things out there.
Yes.
So I'm not saying don't take Motrin at all, but I'm saying do it with caution. Water intoxication. Well, it's no be it's good to so no antibiotic, you should have food in your stomach. Or no Motrin, Advil, you should have food in your stomach because it can cause GI bleed for you, right? Tylenol, not necessarily, but a good idea to have food in your stomach.
Okay. All right. So you bet me the answer. Yes.
You want to go around?
Yeah, I want you to take me around because
so that can you back. We DOT physical.
Okay, me pacho brabe kama yen kakra.
Okay.
Brabe kama yen.
So ye DOT physical so ha omo ka trucks near ade no. Say omo ye annual visits no. Mutimi ba na wa be ye wo DOT no e wa ha no.
Okay.
And no utua cash. Anya insurance base, insurance intua. So yes also yellow fever any ade. Yellow fever no machine no insurance in cover no ofre me schedule na wabe wo Ghana wo wi a utua ka ne ama wo yellow paper no na de ko Ghana say the yensi o ba passport na wo de ko Ghana na say wo di tu kwan na so de ba because we say din no ne bibia ye pepepe ewo yellow passport ni na okwa o ma.
Okay. So the yellow fever na ye adwuma.
Could be a require intino. So Ufi America.
Yes, me as I said what we did.
It is always all come around.
Mpacho brabe ready I do my name bisa no say. Pain in my veins.
I was so vein specialist.
Veins the egu na ho na.
Also a vein vascular doctor, vein specialist.
Especially me nyema. Me de ne ya kese and na ye me ya. But the ya yama me share socks. But the baby woman can cap the way you say kese no ka me nkoye no woman ye surgery. But na me suro.
And you who sa vascular surgeon, a very minor procedure. Into say how varicose veins, right? Yes. I engorged. Into say how right.
Laser or something.
Yep.
Okay. All right. So, my young started what I say no fire check. Me patcho or see kohu doctor or say kona kohu doctor na doctor on show. Better sell be kwa kohu doctor no be show. And into me flip me camera no. Na me patcho udu hanoma. Say net me patcho damn patcho bet me ama address ni biem.
Address ni 477 Connecticut Boulevard.
Okay.
Suite 119.
Okay. 477 and patcho udu ahanoma. Any who say and when you then
Horizon.
What's it you said then?
Horizon. Okay,
yeah. Horizon,
yeah. Light at the end of the tunnel.
Okay.
Right? It's like walking your path in life, going through your own struggles, not realizing that, this big hand, this big God has you, right? Okay. And you think you're alone on that path. But at the end of that tunnel is the horizon, right? There's this peace, there's this thing that you're looking for that's waiting for you there. However, you thought you were alone on your path, but that hand held you.
Something hold you.
So God was holding you through. So that's what horizon means for me. Light at the end of the tunnel.
Okay, so you know me, say I have a Charlton who is autistic, and from what you guys are telling us is that you guys don't know what is the cause of it. Do you? What do you think?
I don't know.
You
Well,
don't?
you know, a lot of things, you know, medicine does not have an answer for everything. A lot of things have unknown etiologies, right?
Okay.
A lot of things are unknown. You know, so they will try to investigate, right? They never definitively sure of something until they go through, you know, diagnostic testing and so on and so forth, right? So nobody is able to really pinpoint. I know people have said, oh, it probably from
Vaccine.
vaccines and what have you, but it's not been proven. So it still remains in the unknown space. So
Okay. And I think 4 days ago, and I wanted to, there's a lady that one more a diagnosis in a bar. And if uti osia o suna, it's very stressful. I have been through I have been there, and now no menya kukudro. And if you being a mother and you were filled with more, say obi parent be sharing na one more diagnosing about what situation no more din asem na obetumi aka kire no.
The person may kind of say a lot of us are also in denial, right? When this huge diagnosis is given us, or even when we see certain things that quote unquote are not, I don't want to use the word normal, but quote unquote things that are not supposed to be there, right? We are in denial, we don't seek help, right? When you seek help and they tell you something is amiss, something is the matter, listen to them and allow them to care for your child. Sometimes we step in the way of our own help, because we think, I'm not saying God is not there. God is there, God is there, God is there. And God is there in Tigrampo Nwama Yuakacha one. So don't step in the way. Allow them to help you. Allow them to give you the resources. If it's reading, allow them to help your child read. And don't just say it's wrong. Behavioral problem, allow them to give them the medications to manage the behaviors. And you, the mother, also allow yourself. It's okay to grieve, but allow them to teach you. Right? And when you need help, ask them for that support. There are support groups, right? There's talk therapy. I know Ghanaians, we don't like things like that. We don't, but it has a place, and we can also benefit from it. So it's a very heavy diagnosis. It's very difficult as a mother to see your child go through something like that, and you're helpless. But it's one day at a time, and accept the help. Accept the help. You are very depressed because of the situation. Allow yourself to be treated. Because if you're in a good space, then you can also care for your child. So yes. I have a lot of patients, and they would refuse antidepressants and stuff, but they are also dying. I want any depression faster. So these medications can help, and just allowing yourself to go through some therapy as the mother, the caregiver, is important. Right? So that's what I want to say. You want to watch?
Yes, Uncle. I'm very. A lot of people are asking questions, and thank you so much. Patrick, take us through.
So this is our reception area.
That's the reception.
So this is where James sits and receives our patients.
Okay.
Right? Yeah. And so my office that we went in already.
Office that I was in.
Yeah.
Okay, and this is one of the scale here.
And this is our examining room.
Okay.
And I like to play music in my rooms.
It's good.
I do. So I get my patients to relax before I walk in. So all my rooms have music playing. This is also another one of our rooms.
So Uba Hanuma.
Yeah.
This is okay.
And then our labs, our machines.
They have
our
a bathroom here,
EKGs
and then you have.
stuff.
Okay, so Ubi Bahanuma, like EK.
We don't let them come in here.
Okay.
Yeah.
But so
we do it in
here. Oh, to move forward, Hado.
Yeah.
A question. Okay, so this is what they have it here. Okay. Okay.
That's it. Yeah.
That's it. So please, Connecticut Hanomedia, Bombadiana bra na bra best Dachi yebefi bronze ni aba. Thank you so much. I'm so happy. Say in the mino abahanum. Nansenya, the last question, then I'm good. Nansenya na me get to know about sickle cell. The whole time in Yami Nimuda. And not knowing say obi AS no be see AS na womo wo akwala no betimi aye SS and not knowing say a big deal and now no ye kese nti wo food we mu no den ye futu na de bema nketesia ene mbranti a womo ba be sha ware ase say ye kwan be ne womo mfa so say de be ya womo wo na womo fa akwala no enkoto ohaw mu ana oyaw mu.
Very important. So be genetic testing, right? You like hemoglobin electrophoresis. Be testing ni omo status, right? And honestly, many years ago, I was Dr. Blvd, and normal Oiganani, and they were going to get married, and they did the testing and found out that they were both AS, and the marriage did not go through. I know they were both brokenhearted, but they were very forward thinking. They knew that if they had married, problems could arise. And that was a very good thing that they did. So the Amime Kane said, especially Ghana, sickle cell is a big deal there, right? So it's very good. See, a testing near who your status and Sakura and Sana, you just
Obi say o shia oba no peno and nti wo mo wo kra Yakopon bebe mu nti akwala no hwe dan ya akwala no.
I know you only believes.
But science will prove you, right? Science has nothing to do with faith. Science is things that are objective, right? 1 + 1 is 2, and we can repeat it and make sure 1 + 1 is always 2. That's what science is, right? And science actually say the possibility of this happening is very great. You can pray and God will hear you. The heavens are open. God will hear you. But I think wisdom also abounds. At this point in time, knowledge abounds. There should be no reason why we should fall back on knowledge. We pick up our phones, right?
That's true.
And fa akwala no and say and wo na adia what can I say and fa wo ba enkoto ha mu because it is very very bad say parents wo dia akwala be wi ase na akwala no obesofa you wan dream akwala no ho nti no first na ye nim nti sisi ase we hia obi na wo pese wo ware nipa no mo pese mo ware a mo kona mo koye
genetic testing.
I can pronounce it. But mon kwana wo mo koye sade no mo make sure say mo be no mo wa akwala no yarebia embebo no me dase doctor. Thank you so much. Me dase Mr. James. And enti mu a mo hwe video no enfama yen na mo a mo Connecticut hade sisi adede ye de bibia bemu and ye bekoso abon dewuru wo a wo hia number na ade a wo hia number no o frame me that's hospital accept health insurance. Yes, she accept health insurance. Yes, she accept health insurance.
Almost all the
insurance. Yes. She accepted. But you waiting about Bobby Swama in Kakra.
Yeah, accepted Husky. Empire Blue Cross.
Connecticut. United Health Group.
United Health. Cigna. Almost insurance ni na accept.
And ye discusso.
We need insurance as well.
Her name is Stephanie.
Stephanie Pettingill.
Stephanie Pettingill.
Dr.
Stephanie Pettingill. Madam Busiafo. Thank you, Nick Bebeda na almost trying. Thank you so much. And we will TikTok for I know it's a video because we will download it and repost it. But if you wanna watch it, we will find us on YouTube. Oko YouTube, ebewo Facebook, ebewo Instagram. Enti medamu ase, medamu inase, medase. Thank you so much.